This is a picture, by the way, of an MRI of someone's lower back. This is the spinal cord here, this big white worm. Between each bone in your lower back, you're supposed to have a white cushion. The white cushion in your spine is called the disc. You have it in your neck, you have it in your mid-back, you have it in your lower back. You have cushions all over your body. The cushions in your spine we call discs. The cushions in your shoulders and in your hips is called the labrum. The cushion in your knee is called the what? Meniscus. These cushions that your spine has is to absorb force and transmit shock. For some of you, you've done a lot of miles on some of those shocks and it's worn away. When you look at the shocks, whether it's the discs or the meniscus or your labrums, they should be big, fat, juicy, and healthy. You want them open. For some of you, you have known in the discs in your spine or in your knees where it's compressed and it's locked. So one of the things that some people have tried to do, before I go over this MRI, I want to go over you because I'm going to explain something. What our office has done is we have taken the best pieces out of every profession and put it into a system. Because I know a lot of you have gone to physical therapy and it has not helped. And my background is in PT. So the inside information is this. If you've gone for physical therapy, there's a difference between general physical therapy and specific carpal tunnel rehab. If you've gone for neck therapy, there's a difference between neck therapy where they're putting some stim pads, some heat on you, or you're going to a physical therapy center and sticking you on a bike for half an hour and leaving you there. There's a difference between general physical therapy and specific lumbar disc McKenzie rehab. Did you know this? No. Because it's not your profession, but we do. So a lot of you have gone for general rehab, but it's not specific for your condition. You go, it doesn't work. And I've had someone tell me, I call them a physical terrorist. I'm like, no, it's a therapist. Okay. One of the things important here is if you've gone for an MRI or an X-ray, if you come to us, we will retake an X-ray standing up. If you've gone for an MRI lying down, if you've gone for an X-ray lying down, and your doctor has told you it's bone on, here's the statistic. 90% of the X-rays that we look at, 90% of the MRIs that we look at, when you come in and tell it's bone on bone, it is not. You might have a portion that's bone on bone, but not the whole entire joint, and there's a difference. If you take an X-ray standing up, I have all my gravitational weight, my load on top of the joint, and it will show you a true joint space. If you've had an MRI or an X-ray and it's been lying down, guess what comes off your body? Gravity. And the space can actually open up and it's not a true joint space. Let me give you an example. If you have a car with a flat tire on it, you can see the flat tire, yes? Yes. If you take that car and you put it on a lift, no, you can't see it. Okay. There's a difference between taking an MRI or an X-ray standing versus lying down. Also ask yourself this. When you took your X-ray, were your shoes on or off? There's a difference. Okay. So some of the things people have tried. Painkillers. Muscle relaxers, which we already went over the side effects. Anti-inflammatories. Okay. Surgery. So what's the statistical success of surgeries? For a total knee replacement, the average amount of years that the total knee lasts is 10 to 12 years. For a spine surgery, and if any of you gone for spine surgeries, the average that lasts 10 years. 50% of the people that go for a spine surgery end up with another one on that cold metal table, which is not fun. The neck one has to do the same thing with the spine. Okay. I already went over the side effects from cortisone. So what are some things that people have tried to help themselves? Have any of you tried to exercise your pain away? Yeah. So some of you have told me, I tried to exercise, but I couldn't because it hurts. And now it hurts, and now you gain weight. It's a medical condition. It's called deconditioning. You're in pain, so you can't exercise. Now you can't exercise, and people get depressed, and they feed their emotions. They're eating unhealthy. They're not exercising, and the problem gets worse. Some people have tried chiropractic. I can tell you, we have them work with us, and it helps a lot of people. There are some people it does not help, and I don't believe you need to go the rest of your life. But for certain people, it has good joint relief. Some people have tried physical therapy, and it has not worked, and I know because I used to work in a really, really big rehab center. It's my background. There's a difference between the general physical therapy and knee rehab, or meniscus rehab, or occupational therapist who specializes in hand therapy. Some people have tried. Anybody try massage? Yeah. Some people have tried it. You know, I call it a jacuzzi experience. It feels good when you're getting it, but it really has no impact on your life whatsoever the next day. Okay. Some people have tried disc decompression, drugs and surgery. These are side effects from painkillers. It's habit forming, causes seizures, constipation, fatigue. Steroids. The cortisone injections. Up to 8% bone loss in 4 months. Okay. It can increase the chance of cataracts, elevates your blood sugar, and suppresses your immune system. Why did Dr. Riley say he stopped practicing traditional medicine? Because he said there was a conflict of the heart. He said because he ended up putting more people on medication when he was done than when he started with a patient. Things have changed. You get it. Doctors today are not prescribing as many drugs as they used to. You spoke about the opioid epidemic. We have one in New Jersey. It is an epidemic what we have here in New Jersey. It is no longer, watch this, 80% of the people who are on heroin were addicted to opioids. It's no longer the drug addict hanging out in the street. It's your doctors addicted to the drugs. Their lawyers, their doctors, their moms, their dads, and their kids. And 80% of these people who are on these opioids, guess what kind of symptoms they have? Spine problems, back, neck, hip, shoulders. Everyone's addicted to this stuff, and it's not working. That's why medicine is changing. The same way they told my grandparents this, and doctors still tell you to take a half an aspirin a day. And I'm not here to put down your doctor, because it's supposed to thin out your blood. But you know what? So does diet, eating broccoli, and exercise. And I've never seen anyone. When you're taking an aspirin on a regular basis, it increases your chances of stomach erosion. It causes stomach bleeding. It's old medicine. You don't have many new doctors telling you that. They're watching you on functional medicine. What are you eating and lifestyle modification? You want to tell your doctor that? You can, but I don't prescribe it. Okay. What's interesting is when you go to your consent form, you can't read it when you go for surgery. I'm going to finish up by saying this. We see this, and this came out in California the other day, that they want to make Tylenol listed as an ingredient as a carcinogen. Causes cancer. Okay. This was in Consumer Reports 2 years ago. Consumer Reports. The number one cause of liver damage in this country. The number one cause of liver damage in this country is what? Who said it? Tylenol. Acetaminophen. It's not alcohol. Okay? Tylenol, acetaminophen is the number one cause of liver damage in this country. This drug, I already said it, taking too much can cause bleeding in the intestines. Causes kidney failure. It causes heart attacks. Aspirin. Don't believe me? Go ask the... Your doctors go, don't believe it all. Okay, don't believe it. Okay. Just like OxyContin, also called hillbilly heroin. That's what OxyContin is called. Right? So I'm going to finish up by saying this, is in ARP magazine, if you want to avoid surgery, some of the most common complications of surgery is number one, the prosthetics can pop out. And I know, because I have people here, like every class, that they've gone for one surgery, it doesn't work. They go for another surgery, it doesn't work. They go for another surgery, and it doesn't work. Yes or yes? Yes. Yeah. Every table there's one. Number two, Most common complications is an infection. Number 3, getting a clot. And if you get a clot, it increases the chance of having a heart attack 31 more times by getting a clot from a surgery. And number 4, permanent nerve damage. How do I know? Because it comes in all the time. We see them. So if there is something, anything that you could do to avoid surgery, why not try it? Okay. Besides doing everything in, we also do in our office things like regenerative medicine, which are things like PRP, which stands for platelet-rich plasma, or something called stem cells that some people have heard of. And I know certain people here with the knee problems, they've gotten a lubricant in their knee. Have you ever heard these lubricants in their knees? Okay. It's called hyaluronic acid. It comes from the membrane of a rooster. I call it WD-40. It's a lube. Here's what it does. It can help lube the joint, but it will not regenerate, it will not rebuild, and it will not repair the cartilage material. You get it? It can prolong a surgery, it will not prevent it. But with things like regenerative medicine, like PRP and stem cells, we know it can actually regenerate, rebuild, and repair it. These are things we do in our office, and again, without surgery. The reason we do this, it's where we live, it's where we work, and it's part of our community outreach to help people. We feel that we boldly want to step out and speak to people because we're sick of people being cut and being drugged, and people just going, there's nothing else I should do, and I just have to live with it. This is why we do classes like this. Our offer is to see if we can help you. We cannot help everyone, and we have to go through a process to determine whether you're a candidate for somebody else to help. What is our success rate? If we accept your case, we have an 80% success rate on helping people. What does that mean by success? Not just feeling better, but functional improvement. What does functional improvement mean? It means that you should be able to go back and do what you were doing before 80% better. Going up and down stairs, going shopping, less tingling numbness, opening up jars. That's improvement. Okay? So, there's no charge for it. It takes about 45 minutes to do. Let me give you a few reasons why you should do it. Number 1 is this. Most people's problems don't get better. They get worse. The aches and pains you have now are usually the same ones you're going to have later, except much worse.